Hi, doctor. Thank you so much for meeting with me.
It's my pleasure. I'm sorry to hear you've been having so much trouble.
Yeah, I have been having a lot of trouble, and I haven't heard of, someone having like back issues and neck issues at the same time going around. So
Yeah.
it's just really scary, and I've been going in like in a rabbit hole, like just going, looking at YouTube clips and going here and researching there. And it's my family will ask, and I'll ramble, and I'll say this pain and that pain. But what I end up doing for you, so to keep my story straight, I end up writing it down
Oh, great.
because just to see the events when they started, because it was just the onset of everything was so. It started as such light pain that it progressed to what it is today. So it's not
Mm.
like it just came sharp and here I know what caused it. I don't know, but I just have all these events that I could just put together at this point. So if that's okay with you, I can go ahead and read what I wrote.
Absolutely. I'd love to hear it.
Okay, so I've been going through this for about 7 months. I went from history of no pain to where I find myself today with symptoms on my legs and my neck and my arms. And what they started as a light onset pain to progress to what it is today. And I know that pain is the way that your body speaks to you. It's trying to tell you something is wrong, and I need help to find out what is trying to tell me. And it all started in December 22nd. But before I start with that, I think there's two things I should mention. I my source of activity was going to Pilates about 4 times a week, and I did that for the past 2 years since December 2020. So that was my source of activity. And also now looking back at my back pain history, I do remember I had an upper back pain in December of 2022, and that was caused because I spent like 2 days hunched over my work desk. Like it was just a really bad working days that I was slumped over like in a hunchback, and then for 3 days, my upper back between my shoulders, it was just in so much pain. But I alleviated that with stretching, and that lasted 3 days, and then it went away, and I completely forgot about it. Now looking back, I'm thinking, I wonder if that had something to do with it. Don't know, but I thought I should mention it just in case it's a piece of the puzzle of what I'm going through. But where I did notice there was definitely something different is in December. Could have been right after this. Not exactly sure, but I noticed a light pinch on my buttock, on my left buttock, and during a Pilates hamstring stretches, and I only felt it there, nowhere else. When I was walking, I was fine. So what did I do? I engaged in vigorous stretching. So I stretched, I overly stretched, and I even increased going to Pilates 7 times a week now. So moving 3 months later, mid-March, the pain did not go away. As a matter of fact, the light pinch bud intensified, and it radiated down the back of my left leg down to my knee. Now I could feel the pain when I was walking and I was standing. And for a period of about 2 days in March, the pain extended all the way down to my calf and my foot, showing the symptoms of sciatica. But that was about just 2 days. And then it just came officially by April, 4 months later. The pain was localized, and I could localize it now. I described it as hip pain. It started in the hip, like it went all around. It wrapped around my inner thigh, my knee, my groin, and up to my to my hip flexor. And I also started observing during March muscle spasms when I was doing Pilates exercises, especially when I was loading just that one leg, the left leg. The exercises that I was doing in the past 2 years with no problem now were causing me to spasm the on the inner thigh. So that was really scary. And I knew I went to go visit a chiropractor, and he ruled out disc herniation. He checked my back. I asked him about scoliosis. I'd been diagnosed when I was in middle school with could this be something that can cause it? And he said, 70% of people have it, and just most likely not. So he adjusted me, and I just went over. I figured this would help. it did not. A week later, I went to a wedding. I wore heels for the first time since I was going through this, and I danced just at most 1 hour. You know, I love dancing. Just, I'm not a professional dancer. I just like getting on the floor out there and just dance. But I was, by the end of that, my hip flexors were in pain. It was just radiating down to my TF muscles, my groin, and my leg was exhausted, and I was involuntarily shaking. And I knew I had to do more than just to go to that chiropractor. But at the same time, during May, I started also noticing like radiating pain, which I was kind of ignoring because I'm like, oh, what's going on in my arms? So it was going up. It would go up from my arms up to my biceps. Sometimes it would feel just radiating pain. Sometimes it felt as burning. Sometimes it just came one arm or just not the other. And it was for a period of about 2 weeks, and it came on and off. I tried to ignore it and forget about it. But for the first time in Memorial Day weekend, I had like neck pain that was just radiated back to my back of my shoulders. And that lasted about 3 days and forgot about it until I went in June to the second chiropractor. Now this one's, she asked more questions. She did a thorough nerve exam, asked a lot, and she diagnosed me with sciatica. She said my S1 nerves were not working, didn't pass the reflex test in the Achilles, and I most likely had sciatica. And she also mentioned, she asked if I had pain anywhere else. I said, my arms, and she mentioned that she found pathological reflexes on my fingers and my shoulder. So she's the one that kind of suggested an MRI for my neck, just in case if we did the physical therapy didn't work. So I decided to also involve my primary doctor in this. But anyways, during the time between I can see my primary doctor, I initiated physical therapy. And then that's when pretty much all the other symptoms started coming in. I started experiencing tingling on both sides of my leg now, both left and right. And my right side started feeling numb, like especially the toes, the middle toe and the what is it, the ring toe, and like going on top of my foot, and then the tingling would come up. And also another symptom came on my right leg. My calf would be twitching when I would walk. It would twitch, and it started progressing to not just when I walk, but an all-day thing. Towards the end of June, on the 6th month, I started twitching so much that my calf became exhausted and tight, sore to when I would walk. So that was just really perplexing. And the way that went away, I spent a weekend on my belly, mostly, like just as much as I could. And then the soreness went away, but the twitching came back, and it's still there. It goes on and off. My right leg also started experiencing growing pain, but on a much smaller scale. I would describe it more like branches that are coming down from the right, but the whole month of June, I experienced also electric shocks on my pinky finger and this finger, the ring finger, and numbness on my right hand and also my left hand. The month of July, that's when actually July 1st, the onset of pain just started on my shoulder, and it went down. I mean, I could not move. It radiated from my shoulder to the inner elbow to here to my hand. I mean, the only way I can be is by being my arm straight. And I found out, especially during sleeping, just keep it straight. Don't do. And it did help alleviate for just 3 days, which is so terrible. But since the whole month of July, I have been babying my arm. It's just been in pain. One day it could be the pain mostly on my shoulder. It intensifies. It could be on the inner, like today it's in here and in here. It moves around. It keeps me up at night, especially the inner elbow and then the bicep and the shoulder. That's where I feel it more on this side. The left side of my neck hurts, but the pain has not gone down. And I've been having muscle spasms, throughout my arms. I've been treating my neck with ice packs, Lyme massages, and I work on a standing desk so I could keep my arms straight when I move the mouse, or if I'm sitting, I have a table or something, I do it on the chair where I move the mouse. Also this month of July where my hip, since I've been focusing more on my arm, but my hip pain's still there. It still causes the same symptoms if I overdo it on exercises. The growing pain will return and go down to my groin, and it can radiate to all the way to my knee. So I just have to watch how much I walk. I have not returned to Pilates since mid-June, since I'm afraid to re-trigger. In mid-June I went to a class and we were doing one leg exercises, and immediately my legs started spasming and got exhausted, and it set me back 2 weeks, like where the growing pain and in the back, it was just hurting for. So I haven't returned, and that's where I'm at today. That's with I'm sorry, just so many symptoms, and I'm wishing you can, maybe you've heard of someone else going through this or have an idea, look through my MRIs. It seemed like the reports that we got, it just seemed like I have nothing, but that's just according to the radiologist. So I'm wondering if a professional like you can give me some guidance.
Absolutely.
I'm so sorry.
Oh my gosh, you poor thing. It's been a terrible, terrible 2023 for you. Like
Yeah.
2020 wasn't bad enough, right? Now it's 2023. Um, can I ask you some clarifying questions?
Absolutely.
Okay, the problems you were experiencing in your legs, where the twitching,
Mm-hmm.
could you see the muscles fasciculating, or did it just feel like they were contracting?
It just felt like it. I couldn't see it. I was looking and I couldn't see it.
You couldn't see any actual muscle contraction, and
Yeah.
nobody else saw any muscle contraction. But it felt like there was something going wrong there.
Yeah. And I didn't
Okay,
ask anyone else because I just, but yeah, I stared at it and I just didn't want to freak out my son. And my son is, I don't know, but yeah, I didn't ask anyone. But for me, staring at it, I couldn't see it. It just it feels.
it feels like that.
Mhm.
And then you have a son. How many kids do you have?
I have one, he's 13 years old.
13-year-old boy, and you're
Yeah,
married.
I'm married, yes.
And what kind of work do you do?
I'm a tax accountant and I work
Oh,
from
okay.
home. So that's
You work
helped.
from home. Okay,
Thank goodness that's helped a lot because I'm able to get up and just do exercises or it helps out and put
for
ices
sure.
wherever I need to. Yeah.
Yeah. And what would you say your worst problem is right now? Is it the arm pain, or is it the groin pain on the left from the back, or what is it?
Right now is my arm pain. It's
On the
July
right.
on the right. Yeah. Here.
And that does that go into one of the fingers?
So the it goes into these two fingers,
Hmm.
into the pinky and the middle, and
Hmm.
I'm sorry, in the ring finger.
Yeah.
And
Do you have any pain in your elbow?
here goes
Yeah.
inner elbow. It
Yeah.
goes, and sometimes it could go sometimes to here into yeah, right
Feel
here,
your inner elbow. There's like a groove between the two bones right here.
right here. Uh-huh.
No, 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 go around. Yeah, right there. Keep going, keep going. Yeah,
Oh,
right there. Rub
oh,
that.
right here is
It's okay.
it's okay. Yeah.
And you don't feel any pain shooting down into your fingers when you do that.
No,
Okay, are you right-handed or left-handed?
right-handed.
When you work, do you put your right elbow on the table?
I I'm pretty now. I'm not, but I'm sure before all of this, yes, I did
Mm.
everything just terrible, like on
Yeah.
the table. Um,
Well, as an accountant, you work long periods with numbers. It's probably hard to keep track of what's
right.
going on. Okay.
And especially January, it's our end of the year busy season. So I spent
Right.
hours that whole month when this all started.
Yeah.
And our busy season this year extended all the way like to April, and I was just in the worst postures and the worst. It's probably one of the most difficult years this year in our in this career, in my job, where I've had to work.
Counting is such a sprinting sport. It's like you're kind of going on, and then, okay, guys, for the next 4 months, we're going to give it all we've got.
Yes, exactly. Like the summer is just, yes, all you've got for 4 months. Exactly.
And then the rest of your life, how is it? Is anything happening that's significant? Is your marriage okay? Is your son okay? Is everybody else healthy and happy and good?
Yeah, I was telling Phoebe that we're a very healthy family, and about the worst thing that had ever happened to us is my son getting little league elbow, and
Hmm.
me trying to find out what to do, and the doctor's talking to me forgetting stuff, and me rambling, and but yeah, the only one is my mom. I think that has helped. My mom has she 5 years ago she developed knee pain on one side that she started complaining, and she then the other knee went bad, and then her back, and anyways, 5 years later she can't walk, and
Oh my God.
she says it's sciatica, and in her story, and I remember I was there and I was listening, and just so that's part of the fear too. Like, am I going to end up like my mom? And I gotta do, and she went to a route with just bad advice, just bad doctors. They gave her tons of pain medication, and somebody said you don't even need surgery. It's just all kinds of stuff, and I just feel so bad. It's so that's about, but everyone else is healthy. Just my dad, and just seeing my mom just deteriorate, it just really affected me.
Oh, how could it not?
Yeah.
Right. And do you tend to be like your mom? Things just come your way, and of course it's unnerving, for sure. All right. Well, we got a lot of imaging to look through. Are you ready? Are you ready to look at some of this stuff with me?
Yes, I am.
So this is the MRI of your back, and this is your back. If we go straight up to your head and then down to your bum in this view, which is right down the middle of you. So
Mm-hmm.
if we go straight into the L4, L5 area, I see a lot of really, really, really positive things in this picture, Sylvia. Your vertebrae are in the perfect curve. If I
Oh,
would have done an MRI on you when you were 16, it looked exactly like this. It's perfect.
oh wow.
Each disc is very healthy. The discs end flush with the back of the bone, and here they go. Now, I can tell you this right now. I know you're worried about your mom and everything that she's gone through. Your back is very, very healthy for your age. There's absolutely no congenital problems here, and there's nothing to worry about as far as um, going down a really bad road like your mom did. You know what
Okay.
I'm saying? That is just not in the cards for you. You've inherited, I don't know what happened to your mom, if it was an injury or what it was, but
Yeah.
it's not like that for you. Or maybe you got your dad's back. I don't know, but
Yeah.
you got a good back. So let's
Okay.
put that to rest. You are not your mother. You are not going down that road with your low back. It looks really, really good. All right, I want to look at some specific things because you're having some symptoms in your legs where the pain comes down on into the left groin and on the left inner thigh. And that is very suggestive of the left L3 nerve root. And here's your 5-1, 4-5, 3-4. The L3 nerve root is going to be right in here. There it is on one side. It looks perfectly healthy and normal. Here it is on the other side. It looks perfectly healthy and normal. So you have absolutely no issues with your L3 nerve root. Let's look at it in the perpendicular. So we're
Mhm.
going to start at that L3-4 level. And here's the nerve coming out to the right. That's okay. On the left, we want to take a very careful look because that's where the pain is. That looks fine as well. You're a little bit narrowed here, but not enough to be causing significant pain or problems. Let's go down to your L4-5, same thing, looks fine. Let's go down to your L5S1, same thing, that looks fine too. That looks really good. So all good, all good, all good, all good. Yeah, I think your low back symptoms are actually your left hip. I see this a lot in women who do Pilates that the Pilates is like super stretchy for the hip. I mean, you
Yes.
think about what you do. You a lot of it is actually about getting your hip and your sacroiliac into maximum range of motion situations.
Yeah.
That pain that goes into the groin is very characteristic of hip pain. At some point, you really should get an x-ray of your left hip to make sure there's no arthritis. I don't think there is. I think you aggravated it doing Pilates and you instinctively knew it and you backed off the Pilates and you started having, as you went from exercising a lot to not exercising a lot, you went through what I sometimes call exercise withdrawal.
Mm-hmm.
And you get these weird symptoms and the pulsing and the fasciculations in the leg. Those are very scary things in a stressful time. I don't see anything to fear down in your back. Everything looks okay.
Oh, really? For my back? Okay. Oh,
Yeah.
that's great.
Yeah. Your left hip is probably a little bit sticky, and that might be a problem as time goes by. But the Pilates is actually a really good way to treat that if you can kind of rein it in. I kind of think of it like surfing a 3 or a 4 or a 5 foot wave is really fun.
Mm-hmm.
Surfing a 50-foot wave can kill you. So
Yeah.
don't do the 50-foot wave.
Just
Do the
go
three
there.
foot wave, right? You go back to Pilates, but don't go back like you know what I'm talking about.
Yeah.
If something is too much, and then physical therapy is very unlikely to be helpful for this, but chiropractic, if it flares up, chiropractic treatment for the SI joint and the hip is very effective.
For the SI joint. Okay.
Yeah, yeah.
Okay.
So you're going to be better doing that. All right, you ready to look at that neck?
Yes. That neck that's the one that's,
Scaring you?
yes.
Poor baby. All right, here's your neck. And we're going to start with these images. So here we are at the base of the brain. And this is where your head meets your neck. And then we go down the neck. If we follow the brain, looks perfectly healthy and normal, and we follow that down, we get into the spinal cord.
Mm-hmm.
And I'm very happy I don't see any huge disc herniations or anything pressing on it. Again, there's a very nice curve. Again, there's very healthy discs. So all of these are very positive and very good things. If we then look at the perpendicular, so now this blue line here is what we're seeing over here. We're going to go to the level, the the pinky finger and the ring finger are the C8 distribution. That's the nerve that comes off between your C7 and your T1. Here's your C2, 3, 4, 5, 6, 7, 1. So this is the disc. If there was a problem with a disc and a nerve root, it's going to be this guy right here.
Mm-hmm.
And so we're going to look through there. Those are the images we're seeing here. And as we go down through the disc space, we see your spinal cord and the foramina, the holes that the nerve roots come out of. And all of this looks totally normal. I don't see a disc herniation. I don't see anything specifically pressing on a nerve root or a disc. So I don't see anything in your neck that is causing your right arm pain.
Okay.
Now, I want you to do something kind of funky. Take your hand like this, your right hand, and I want you to scratch right there on the inside of your right ring finger. Does that feel normal?
Yeah.
Now do the same thing, but on the outside of that finger. Does that feel normal?
It feels normal.
And how about your pinky?
It feels normal.
Okay. Sometimes, especially in accountants, problems in this area are not from the neck, they're from the ulnar nerve. The
Uh-huh.
ulnar nerve comes through the elbow, and your son actually had an ulnar problem, it sounds like.
Mhm.
So you know about the ulnar nerve. It's right here between that bump. It's right there. I can even feel mine just by doing that. I can kind of feel mine a little bit. The thing that gives it away is the ulnar nerve splits this finger. This part of the ring finger is ulnar and this part is not. So
This
if
part,
you ever
which
feel it,
part?
like it,
Oh,
yeah, the outside part, the part toward the pinky. So it's
oh,
the
the part.
pinky.
Mm-hmm.
Yeah, if you pay attention, if you're getting something like half of this finger, just the outside, it's the ulnar nerve.
Okay.
And look what you're doing right now.
What?
Your right ulnar nerve is on that table, isn't it?
Oh, no, no,
Oh,
it's not.
was it hanging off? Okay, I can't really
It
say it.
it's
So
hang.
that what often causes it is it turns out a lot of times people are leaning and you're in a posture where the nerve is being crushed all day, and then
Mhm.
it starts to get worse at night. You can wake up with it. It's a problem. And the first thing is to be aware and make sure. If it gets worse and it's not going away, then you need a test called an
Okay.
EMG, which is
Image.
done by a neurologist.
Okay.
And they would go through and try to find out, they measure how the current is going down the nerve and whether it's healthy and whether anything needs to be done about it.
Oh, okay.
You definitely do not need spine surgery. I think your nerves are acting kind of creepy to you. You're getting the sensation things are going on. It's probably not going to help, but I would add a multi-B vitamin to your daily. If you're okay with vitamins,
Yeah.
take a B complex vitamin. It's probably not going to help, but if there is a little more vitamin B is crucial for your nerves. If that would help a lot of this go away, then that would be a wonderful thing to do. And it's very easy to do and it's very inexpensive. You
Yeah.
do not need spine surgery. You need to go back to Pilates, treat your low back pain problem as a hip pain problem. Go forward from there. You have a series of things. You came through a difficult time at work. You were prone to think about this because of this terrible experience that your mother had. Sylvia, you are not your mother. You have
Okay.
a good spine and a good neck. You've done everything right by doing Pilates. It keeps you mobile and strong. I can see really good muscle on your MRI. You have a very good skeleton, which should serve you very well as time goes by.
Oh, thank you. So should I take like have them take an X-ray of my hip so they can
Yeah,
see I
I
have
would have your primary doctor order an x-ray of your left hip and
um
then read the report. And if you have moderate to severe arthritis, then you need to go to physical therapy for your hip. If that fails, then you need to, I don't think you have it, but if that were to be the case, then you need to look at getting something done about your hip, maybe even an injection to make sure that that's the source of the pain. But the first thing is just a plain old fashioned x-ray.
just a plain old-fashioned X-ray.
I feel
Okay.
like you're a little bit of a worrier.
I yes, I
I'm
especially.
married to a worrier.
Are
I
you
know
aware?
about you worriers. Yeah.
Okay. Okay.
Yeah, but it's good to worry, but only in as much as you take proper care of yourself, you do the right things to stay strong, and you act when there's something to act on. You have to learn to just turn it off though, once you've gotten the x-ray and it says no or mild arthritis, then you don't need to you're done with that. Then you need to get back to things like Pilates and put your thought and your intention and your activity into the things that are working for you.
That are working and just okay and just slow down on the well yeah, just it freaked me out when I couldn't the dancing, in my leg and with the spasm and that was but
It was
I
your
was
hip. You remember that and how it went into the groin?
yeah,
That's hip pain.
that's hip pain. So it
Yeah.
just so
Yeah.
I was right that I've been calling it hip pain all this time, but we focused on sciatica in my back
Yeah.
and I was doing cobras and all these exercises and I don't know if that's what caused.
Mm-mm.
No. Okay. All right. So, well, it makes me feel better, and I'll move on with the ask my primary for a hip a hip X-ray, and then we'll move forward from there.
Do it. It was so good to meet you.
Oh,
I'm
thank you.
excited for you. You've got a smart lady, great job, family, 13-year-old. If you could just get that 13-year-old boy up and grown and out of the house, you're gonna have it made.
Yeah. Okay. Thank you. Thank you
All
so
right.
much, and all the greatest wishes for you, and thank you for what you do, and just give so much hope to a lot of people, and when I found you. I just admire so much for you doing this for us and people across the world that have gone to you. So
It's my pleasure and it's my honor. Thank you so much for trusting me and for coming on the show.
all right, thank you.
Yeah, have a great day.
Thank you. Bye.